My name is Madeline Birch, and I'm presenting Trends in Diagnostic Point-of-Care Ultrasound Reimbursement for Medicare Beneficiaries among the United States Emergency Medicine Workforce 2012 to 2016. We have no financial disclosures or conflicts of interest. For background of the study, point-of-care ultrasound allows for rapid diagnostics in the emergency department. A previous study identified a very low baseline prevalence of POCUS reimbursement, less than 1%, among the emergency workforce in 2012. In subsequent years, support for billing accessibility to POCUS has improved via endorsement of governing bodies such as the American Institute of Ultrasound and Medicine and compensation by the American College of Emergency Physicians. Increased numbers of fellowship-trained ultrasound faculty at residency programs have also increased. For aims of the study, we aim to determine nationwide POCUS reimbursement patterns for 4 subsequent years. For methods, we used a cross-sectional study using 2012 to 2016 data from Centers for Medicare and Medicaid Fee-for-Service Provider Utilization, or MPUF, and Payment Data Part B. We defined POCUS examinations using current procedural terminology, or CPT codes, and we defined emergency medicine workforce clinicians by 2 criteria: the receipt of at least 11 of any emergency medicine context-specific evaluation and management claims in the MPUF for that year evaluated, as well as belonging to 6 pre-specified emergency medicine clinician types of interest that were responsible for a majority of emergency medicine care. Those included emergency medicine, family practice, internal medicine, and critical care. Nurse practitioners and physician assistants have previously been identified as a key part of the emergency medicine workforce and were included as well. We specifically examined the 21 reimbursable POCUS studies identified by the 2018 American College of Emergency Medicine Physicians Coding and Reimbursement Guidelines. For results, in 2012, 342, or 0.7%, of the total EM workforce clinicians were reimbursed for diagnostic POCUS versus 801 clinicians, or 1.3%, in 2016. EM physicians represented an increasing proportion of the total workforce, increasing from 86% in 2012 to 94.6% in 2016. From 2012 to 2016, the total of POCUS reimbursements increased from 13,697 to 31,717, with significant growth from echocardiograms, abdominal exams, and thoracic exams. Figure 1 on the left shows trends in Medicare reimbursement for specific diagnostic POCUS applications. There was significant growth in echocardiograms from 4,127 exams in 2012 to 14,978 in 2016. Abdominal exams had 3,682 exams in 2012 to 7,140 in 2016, and thoracic exams grew from 801 in 2012 to 5,278 in 2016. Table 1 on the right shows emergency medicine physicians representing an increasing proportion of the total emergency medicine workforce, increasing from 86% in 2012 to 94.6% in 2016. Some limitations are worth mentioning. The MPUF captures procedures for Medicare beneficiaries only, which is not completely representative of emergency departments operating in military, veteran, or pediatric settings. The MPUF also captures only services that were reimbursed at least 11 times to a clinician in a given year. Smaller hospitals or practice groups infrequently reimbursed for diagnostic POCUS services are likely underrepresented. A conservative threshold of 11 examinations, along with our inclusion criteria of 6 predefined specialty types, likely excludes consulting specialties or moonlighters and is perhaps more representative of the main EM workforce. We examined reimbursement data primarily and not claims or performance data, so we cannot parse out ultrasound reimbursements to providers who also practice in other contexts, such as family medicine practices or urgent care clinics. In conclusion, the proportion of emergency medicine workforce clinicians receiving diagnostic point-of-care ultrasound, as well as the number of point-of-care ultrasound studies, more than doubled from 2012 to 2016. Efforts are needed to understand barriers to adoption of point-of-care use of ultrasound, since only a small proportion of the emergency medicine clinician workforce was reimbursed in any given year. I'd like to thank the authors of the study for their time and Kennedy Hall for his continued support and mentorship.